with 1 in 8 women estimated to be diagnosed with breast cancer within their lifetime, it's important for women to understand their risks. So let's bust some common breast cancer myths. Myth: deodorant can cause breast cancer. So why do people think this? Aluminum is the active ingredient in deodorants. These plug the sweat ducts that stops the flow of sweat to the skin's surface. It's been suggested that aluminum may have direct harmful activity in breast tissue. However, no studies to date have confirmed this. Some research is focused on parabens, which are preservatives used in deodorants and antiperspirants that mimic estrogen in the body's cells. There is no evidence that parabens cause breast cancer. In fact, most deodorants in the United States do not currently contain parabens. Myth: the only sign of breast cancer is a lump. Although the most common sign of breast cancer is a lump, there are other signs of breast cancer too. Less common signs and symptoms include breast pain or heaviness, persistent changes such as swelling, thickening, or redness of the skin, and nipple abnormalities such as spontaneous discharge, especially if it's bloody, erosion or retraction, along with a change in breast size. Any persistent change in the breast should be evaluated by a physician as soon as possible. Myth: breast cancer can only be inherited. Most women who develop breast cancer do not have a family history of the disease. Only 5 to 10% of breast cancer is related to genetic abnormalities. So the rest of us are at normal risk for getting breast cancer, which is 12.4% in our lifetimes, or the 1 in 8 statistic we all talk about. Myth: young women don't get breast cancer. Women who are diagnosed under age 40 have worse survival rates than those who are older, so self-breast awareness is key, and seeing your doctor if you know any changes in your breasts immediately is crucial. What is self-breast awareness? Self-breast awareness is being aware of your breasts, how they both look and feel, and reporting any changes promptly to your physician. Myth: mammograms cause cancer. The radiation emitted from a mammogram is minimal and is less than an X-ray. Mammography reduces the risk of dying from breast cancer by about 20%. Early detection of breast cancer by mammography also leads to a greater range of treatment options, including less extensive surgery and the use of chemotherapy with fewer serious side effects, or sometimes the option to forego chemotherapy altogether. Myth: there's no way to lower my breast cancer risk. Yes, there is. Get moving. Postmenopausal breast cancer risk is about 1.5 times higher in overweight women and about 2 times higher in obese women than in lean women. Women who get regular physical activity have a 10 to 20% lower risk of breast cancer compared to women who are inactive. Eat healthy. A diet rich in fruits and vegetables and limited in processed meats and red meats is key. Limit alcohol if you drink at all. Women who have 2 to 3 alcoholic drinks per day have a 20% higher risk of breast cancer compared to women who do not drink. Avoid tobacco. A review by the American Cancer Society researchers found that women who initiated smoking before the birth of their first child had a 21% higher risk of breast cancer than women who never smoked at all. Myth: men don't get breast cancer. Breast cancer in men is rare, accounting for less than 1% of breast cancer cases in the United States. However, since 1975, this number has been on the rise. Men are more likely than women to be diagnosed with advanced stage breast cancer, which likely reflects decreased awareness and delayed detection because screening mammography is not recommended for men due to the rarity of the disease. Thanks for joining me. I hope this information has been helpful. To learn more about cancer care at Cone Health Cancer Center, go to conehealth.com/cancer. I'm Lindsey Causey.